had a real early flight out of Richmond, Virginia. We went on lots of different stops to see the kids. And then when we got back to the house, I was past wiped out. I mean, I was very, very tired.
We all kind of went to bed a little bit earlier, and I just was tossing and turning, and I kept hearing her coughing, and I nudged Brian like, hey, you need to go check on your mom.
My mom was, struggling a bit. It wasn't really, in my opinion, a telltale obvious issue with her heart, but she was, in retrospect, we now know, having a heart attack.
I could breathe in, but I couldn't breathe out. After, lots of different procedures to test and to evaluate and so on, they decided that I had had a heart attack or was having a heart attack.
She initially had gotten admitted overnight. She presented in the middle of the night with a lot of shortness of breath. Her workup initially in the ER just showed a lot of concern for fluid overload or maybe like a heart failure picture. So after talking with her, plus her lab tests and such, we decided to proceed with a heart catheterization.
Well, typically a cardiac cath or coronary angiogram will get access in the patient's wrist. We'll run a catheter over a wire to the arteries of the heart. We'll inject x-ray dye and image these coronary arteries. So we know right away if there's a blockage or two that we can safely fix with a balloon and stent.
So they go in and they perform, the left heart cath. And if they don't have blockage, well, then they have peace of mind. If they do have blockage, well, then they know what medication to put them on. If they have the blockage and we have the ability to fix it, that means that we caught something before it became critical.
We have a world-class facility here now in New Braunfels with doctors that rival any large city across the nation. We just felt super comfortable knowing that going to CHRISTUS, you were going to get that same caliber of care as you would in any other big city.
So I think it's a blessing coming back to a faith-based hospital where they're praying over the intercoms, and that when you go into the room and they have the cross, above the bed.
I felt very grateful that that was the facility that I was taken to, because it seemed like everything that I needed was right there and was top-notch.